Hi, my name is Garric Vosloo. This is Functional Medicine for Therapists, and what I want to do today is to go through some of the deep root causes of what we see in our practices. And we know that virtually every patient coming through to us has got some degree of inflammation. What we don't realize is that they've probably had low-grade systemic inflammation for a long period of time, some patients for decades. And we know that with chronic disease now at an epidemic state, the US population has been diagnosed at 45% of the population having a chronic disease. We know that there are three finite processes that are inevitable with chronic disease, and that being imbalanced inflammation, oxidative stress, and immune system. So what I want to dig down deep into is just how do you identify low-grade inflammation, and then what interventions you can bring in certain situations. And I want to dig in specifically to cartilage and bone issues, because those are the one areas that we just see so much in our practices. And arthritis is the number one disability out there. And if we don't get a grip on exactly what the underlying root causes are, and it's certainly complex when it comes to arthritis, but I want to dig down deep into just one element and give you some idea how creating a personalized targeted plan can be just so essential to getting better patient outcomes. So the thinking goes something like this, that first of all, you need to be able to identify clinical signs and symptoms that predict a low-grade inflammation state, with that patient coming to you complaining of whatever issue it may be. So let's take, for example, a chronic knee that is recurrent and coming back to you. What can you do to identify low-grade inflammation? There are a number of factors that you can go through to kind of, from your clinical reasoning, to confirm your clinical reasoning that this is the situation. Firstly, the number one is to just do testing. So you can do blood test and figure out, is the highly sensitive CRP higher than 0.7? That's going to give you an idea. Is the interleukin 6 too high? Is TNF alpha too high? Is fibrinogen high? Is there an increase in ferritin? Is there a higher sedimentation rate than there should be? So all of those factors can tell you as far as on a blood level. And that's all in fair well if you have access to previous records, or if you can speak to their PCP or specialist and get those results to you, you're going to find out exactly what's happening there. But let's say we got to go to the next level and start to think, how then can we start to identify low-grade inflammation? And we can look from a physical evaluation point of view to start to pick up signs. And there are many signs that can give you this kind of clear picture that there's been a long-term process of low-grade inflammation. One of it is to look at the skin, and often you can get this black velvety skin called acanthosis nigricans, and that is an indication that there's been some kind of blood sugar imbalance or insulin sensitivity dysfunction that is now leading to a low-grade inflammatory state. There are many other factors, and the one key factor that I want to speak to you today about is, are you doing a physical evaluation in the mouth? The mouth and the oral cavity is a high turnover tissue that can tell you a huge amount. One factor that's been related back to genetics, and that is another area that I want to speak to you about, is just on a genetic level. When we do genetic panels and we find out inefficiencies in certain genes of the interleukin 1s, interleukin 6, TNF alphas, CRPs, particularly that help to regulate the balance of inflammation, is the interleukin 1 group, and there's a whole group of them, that when they are inefficient, there is a strong association back to bone and cartilage degeneration. And this now becomes an important link because it is also associated with periodontitis. And if we now have those skills, that we've got this patient in our office that has joint problems, we then can confirm that they've got oral health issues. Another association with interleukin 1 inefficiency and low-grade inflammation is a family history of cancer, cardiovascular disease, diabetes. So those are all very well researched and associated with interleukin 1 enzyme inefficiency. In other words, if you've got lifestyle factors that are tending you towards inflammation, that inefficiency in those genes are going to make that inflammation amplified. Now, when we're looking at low-grade inflammation, that amplification can just be enough to offset all those imbalances and start to create this pain in the joints and other health symptoms that are coming along the way. And this is the joy of functional medicine. In functional medicine, we're not just looking at that isolated joint, analyzing it, which we are very good as therapists to do. That is our skill. We can really go down. We're going to check the range of movement, swelling, function, look at the core stability, what is the whole kinetic process that we've got to fix there. That's all good and well. But what is happening at a cell level, at the biochemistry level, at the genetic level? And what can we do from that point of view to help our patient to go to the next level so that they are not just getting some symptom relief in our practice and then we're waiting for them to come back in months' time. What we want to do is to be able to get right down to that deep root cause, identify where this low-grade systemic inflammation is coming from. So we need to identify it first, identify where it's coming from, and then create an intervention that we can lower that low-grade inflammation back to optimal levels. And this we can certainly do. So we can either be tracking it through these physical evaluations that we're checking on a daily basis, or we can be doing it through organic tests or serum or whatever it may be. Just looking at the anthropometrics. So there's many indications at an anthropometric level, like waist circumference size has been related very much to low-grade inflammation, body fat percentage. So when we start to pick up all these different factors, our clinical reasoning tends to point us in this direction that this patient more than likely has low-grade inflammation. And then we can confirm it with testing. And one of those testings, like I mentioned with blood tests, could be highly sensitive CRP, interleukin 6, TNF-alpha, CRP, and so on and so on. So what is interesting is what we are finding with, particularly with the interleukin 6 inefficiency genes, is that the research is showing that when we have an inefficiency gene, there are certain interventions. Now, one research shows that when we bring in berries into their diet, and this is just an example to show you how it works, that those patients have a much more amplified effect in reducing their inflammation down, rather than that person that has all these low-grade systemic effects plus this clinical signs and symptoms of arthritis that do then incorporate berries. They don't have as good effect as that person that had the inefficiencies in those genes. And that's how specific we can start to become to target and create a personalized plan to help that patient. That's when we're really, really getting specific, and we can start to say, otherwise you're taking all the great health possibilities and strategies and you're saying, okay, here is 150 strategies to help your health, and you've got to do them all because we don't quite know which one is the right one for you. So what we're doing now in functional medicine is we're able to actually, through research, know, like for example, an inefficiency in that gene, that if we bring that health factor in that's going to help that patient, we're going to get a better result long term. So I hope that kind of makes sense in how this new thinking with functional medicine plays an essential role to becoming very personalized, very targeted when we want to get a patient better into the long term. And this is the joy of what we're able to do with a patient that comes in with a chronic disorder, that we don't necessarily have to discharge them at a point where we've relieved some pain, we've improved their function to a certain degree. Because what we want to know is all those other clinical signs and symptoms that I've spoken about, from anthropometrics, clinical signs like things on the skin, oral health, and then the blood testing, and see if we can track those and see if there are changes into the long term towards optimal wellness and preventative medicine. And that is really, really just an extraordinary feeling when you know that you can help a patient to that level with real clear objective findings that you are tracking and fine-tuning along the way. So I hope that's helped, just to give you some insight for today. And if you have any questions, if this is something that really intrigues you, what I suggest is either watch our webinar if you haven't. You can go through a replay on our website, or you can book a call to speak to us directly, and we can see exactly where you're at in your clinical setting. What do you think about functional medicine, and how can it be customized for you so that we can help you integrate functional medicine into your practice, into your setting as optimally as possible, and that you can make a difference in your community. So this is our mission, and we're here to just help and facilitate and get you to understand that functional medicine can be integrated into your practice. So until then, my name is Garric Vosloo. This is Functional Medicine Physiotherapy, and we're looking forward to hearing from you. Take care.